Welcome to the Spine and Rehab Specialist Podcast Series, episode number 2. I sure hope that everyone listened to and enjoyed our very first episode that we did on post-COVID-19 rehab. And if you haven't listened, please do so. I think there was some really valuable information on the rehab that's possible for patients who have had COVID-19. In today's episode, I'm going to be talking to Dr. Anthony Durant, one of our physical therapists, about musculoskeletal ultrasound, or we'll call it from now on Msk Ultrasound. I'll tell you a little bit about Anthony. He's been with spine and rehab specialists since 2016, and actually even really a little bit before that because he was a student in our clinic while he was in his program for physical therapy. Anthony was born and raised here in El Paso, graduated from the Doctor of Physical Therapy program at the University of Texas at El Paso back in December of 2015. He's been specializing in spine care with further education in the McKenzie method. He's also certified in the LSVT BIG program for patients with Parkinson's disease. He does some dry needling, and he helps me take care of the athletes at UTEP. And now he's, doing the Msk ultrasounds in the clinic. So he is my guest here, in this podcast today. He's definitely a busy guy. So Anthony, welcome to our podcast.
Thank you.
So we're definitely glad to have you here, today. So, Anthony, can you tell us a little bit about the technology that's being used in Msk ultrasound? Tell us a little bit about what is it?
Yeah, sure. So we're all pretty much a little bit more familiar with this type of tech than you might think. Basically, it's the same technology that we use, when a doctor is looking, at fetuses from pregnant women. It's the same technology. We also use this, in case if you've ever had like abdominal issues or, something of that nature. Typically, a doctor will do an ultrasound to, check the organs on the inside. So, it's pretty out there. It's nothing new.
Okay. Yeah, actually, I think I had an ultrasound when I had my appendix, as a problem, and then I had to take it out. So, yeah, so it's essentially the same technology, but now we're looking at, bones and joints and tendons and everything. So, I actually heard about this technology because it's relatively new in the medical field to actually use it for musculoskeletal issues. I've heard about this several years ago, and the more I looked into it, the more I thought that we have to get this to our patients here in El Paso. So at Spine and Rehab Specialists in 2019, we decided to sign up with a company called Hands-On Diagnostics. They're out of New York. I've actually known the owners of Hands-On Diagnostics for many, many years. They're good friends of mine. So I figured they would give us really good support in bringing this, really cutting-edge technology to El Paso. So we're very glad that, we have this now in our facilities, and that we can, this way help our patients, a lot better. So Anthony, you want to tell me a little bit about how, your training, how your exposure has been to this Msk ultrasound now?
So the exposure with this, with the training and everything involved has been pretty phenomenal. We were able to train in New York with the hands-on guys, and, they have brought us a lot of mentorship and, a steady road on how to, solidify our practice here. It's been very rewarding so far that, we've been able to bring this, I guess, new tech in the field of physical therapy into this building, into the clinic, and, using it has been amazing, to say the least. It just opens up many doors for us.
Yeah, and it's really been ongoing training because I know we do clinical rounds every week, and we're really fortunate to be supported by, some people that have done this for a long time. I know the one that reviews our scans, she's just phenomenal. She literally wrote the book on Msk ultrasound, so that's really been awesome. So great. So let's talk a little bit about the different structures that we can evaluate with this Msk ultrasound. So can you go over a little bit on, what are we looking at? What structures are we looking at?
Yeah, sure. So, we pretty much can scan anything in the extremities. Anything in the arms, shoulders, anything down, elbows, wrists, fingers. We scan the lower extremities as well. There's not really a whole lot of limitation with scanning the extremities. We don't really do a whole lot of scanning of the spine and the trunk region. It kind of gets a little bit fuzzy there, but that's okay because there's plenty of diagnoses and information that we get from scanning the extremities. I mean, how many of us have problems with our elbows or shoulders, especially our knees and such? So it's very dynamic with, how we can use it to scan the body.
Okay. So we're looking at So, muscles, tendons, we
Yeah.
look at ligaments.
Muscles, tendons, ligaments, anything of that sort. You have a shoulder pain or something like that. We can scan the muscles. We can scan the tendons there. We can see what's going on the inside.
Good, good. So now, if I'm listening to this, it really kind of sounds like the same structures that maybe a doctor would order X-rays for or an MRI. So why? Let's look at why would we actually use this MSK ultrasound rather than an MRI?
So one of the things that patients come in with, and it's kind of like the status quo, and it's been the status quo for a long time. It's you go to the doctor will do an X-ray, and we don't really know what happens with the X-ray results. Sometimes we get an answer, sometimes we don't. Sometimes we go back home and the problem's not really solved. We wait a week or 2 weeks for an MRI, and then we have the MRI and wait another week or two. So it's kind of like the status quo. And with the MSK ultrasound, we have the ability to do this in front of you right now. There's no extensive waiting period. There is a whole lot of advantages to having this with us, because I can show you what's going on with your shoulder at a moment's notice. So that's one of the big benefits to having some of this tech with us.
Yeah, I think one of the things that patients really appreciate is the fact that they can see what you're doing. If you go over an MRI, so you're laying in this tube, that's pretty uncomfortable. It's a hard surface. You have to lay still, don't move.
Yeah.
It takes a long time, and you don't really see. I mean, all of a sudden, magically, several days later, your doctor gets the results, but a patient doesn't really get to see that. And I think that's one of the neat things with with the ultrasound. You can show them what's going on, and they see it, and I think they really appreciate the fact that they can actually see what's going on, not just have to say, "Hey, I'm your doctor, trust me." It's like, no, they can see it. And I think that's one of the awesome parts.
Exactly. Yeah. I mean, it's the computer, the machine itself is like a laptop. It's very portable, and then when I can see a problem, I can say, "Hey, look, this is what I'm seeing here," and patients are pretty much have shown a pretty interesting response, and an amazement to some of the results that you can see. And and it just kind of, as you mentioned earlier about the MRI machine, if you've ever had an MRI, I mean, it's a small tube. It's you got to lay in there for an extensive amount of time, in a tiny tube for 30, 45 minutes, however long the study takes. And how uncomfortable is that?
I've had a couple of them, and they were pretty uncomfortable, definitely. The nice thing with the MSK ultrasound, they can either lay down, sit down.
Yeah.
They're not in a tube. They're not, don't have to worry about, claustrophobia. So I think that's a really big advantage over that. Also, certain conditions you can't do an MRI, like if you have a pacemaker or something like that, we can still do the ultrasound. So there's definitely some advantages of, choosing the MSK ultrasound over an MRI. So how about the time involved? So how long does it take to do an ultrasound on somebody?
Not 45 minutes. It depends, I say that jokingly, but also it depends on what I'm looking at. The scans, as I've been practicing, I get a little bit faster and faster each time I do this. So I can pretty much scan a shoulder joint in 15 minutes, 20 minutes at most. If I'm doing one, maybe tack on another 10 minutes if I'm comparing to the other side. So definitely much faster than having an MRI done. Very much so.
Yeah, definitely. I think that's a big advantage too. And like we said earlier, you really get the results immediately, right? Yes, we're still getting them confirmed by our mentors in New York, but we can look at it immediately. And the nice thing is, again, that we can go over it with the patient immediately too. So I think those are really some big advantages, that we can just do it, right then and there. I mean, technically, you could really, if somebody would walk in right now, as long as you don't have somebody else on the schedule, it's like, hey, let's do the MSK ultrasound and let's take a look at it and let's get some results immediately. I know we had, one patient come in, one of our employees' husband, who had a really bad ankle sprain, and had him come in right away, look and say, okay, is it an ankle sprain or is it a fracture? We could determine that immediately, not having to wait for X-rays and everything. And of course, X-rays, that's radiation. Who wants to get radiation all the time?
Exactly.
So I definitely wouldn't want that. So
yeah, I mean, the ultrasound on that, it's radiation. Ultrasound really is probably the safest means of scanning inside the body. It's an ultrasound wave. There's not really any contraindications to using ultrasound for imaging.
Yeah.
Anyone can have it. If you have a pacemaker, you can have it. And you can, obviously, if you have an open wound, we won't be using the ultrasound. But otherwise, there are no contraindications to using this type of tech.
Yeah, which is awesome. So it opens the opportunity for some people that couldn't get an MRI. Now all of a sudden they can get an Msk ultrasound and really look at structures that right now it's hard to look at. So good. So something else that I think is probably important to know is money, right? Even though we may say, well, I want the best test, regardless of money, but a lot of people have high deductibles, high copays, and everything. So money is definitely a factor as well. So what do you know about like the price of an MRI, comparing it to the Msk ultrasound?
Well, I mean, if you look at the data, an MRI can cost anywhere from $400 to $3,500, depending on your insurance and whatever the stipulations are, and if you compare that to ultrasound, you're looking at maybe at most $100 a body part, a drastic difference between MRI and Msk ultrasound. And plus the results are there. The results are immediate as well. So yeah, I mean, if we're talking about a lot of financial constraints, which many of Americans are out there, struggle paying the bills, so on top of that, now we have a bunch of medical bills, and at the same time, we're not really sure when we're going to get a results or not. So with the Msk ultrasound, it's, a third, a quarter of the price, even on the lowest end of the MRIs, and your results are right there, immediate.
Yeah, so I think that's definitely a consideration as well. I mean,
a huge benefit.
You give me the option to pay, say on average probably about $1,500 for an MRI, and maybe $200 or so for Msk ultrasound. If it's going to show the same thing, I'm going to pick the cheaper option.
Yeah, why not? Exactly.
Absolutely. Now, of course, there are some times when maybe an MRI shows things better than Msk ultrasound, right?
Yeah, of course. We're not saying MRI is obsolete at this point, but we're talking about people who all of a sudden develop a shoulder pain because they lifted up something too heavy, or they crinked their knee when they were jogging, stuff like this, or your average person out there with your average types of injuries that we all get. This is where we benefit them the most.
Yeah, because when things are really inside the joint, it's a little harder to look at with ultrasound. So for like, I'll give you an example on the knee. So you can look at the superficial ligaments, like the medial collateral ligament, the lateral collateral ligament, difficult word. But you can't really look at the ACL, and the PCL with the Msk ultrasound. So there are some limitations, but most of the superficial structures we can look at with the ultrasound.
Yeah, exactly.
So now there's one, and I think this is actually really, to me, a crucial difference between MRI and Msk ultrasound is, for an MRI, you're laying still in that tube, and they tell you, do not move, for the next 30, 45 minutes, because it messes up the picture. That's not the case with the Msk ultrasound, right?
No, not at all. With the Msk ultrasound, like for example, I go back to the shoulder, we can have you sitting. We can have you sitting in a nice, comfortable chair, a chair that allows us, your arm to move, and we can scan there. We can scan the knee. If I'm scanning your knee or your ankle, you're laying down. You can lay down as long as you want. We can put pillows, however you need to be propped up and stuff. So it's not a grueling task to stay in a tiny tube. I mean, some of us have one type of pain, but we also suffer from another type of pain that laying down isn't all that easy for some people. So if they're looking at the shoulder, but you also have back pain and then they stick you in a tube, that's not exactly a comfortable, journey for you. Some people talk about having to pill up, take their meds before they go into the ultrasound machine, or med up after the the MRI machine, So it's pretty grueling for some patients to have to go through a 45-minute examination like that. And on top of that, you're probably going to have to wait before you have the MRI. So, it's not very comfortable with MRI machine sometimes. So that's why I like Msk ultrasound. It's easy access. It's comfortable for the patient. It's comfortable for the therapist. It's just all around, better.
Yeah. And I think the unique advantage is like there's definitely times that I want to look at what happens with movement, right? If you look at a shoulder, most people, if they have shoulder pain, probably doesn't hurt them much at rest, laying down. So if they're in that tube in the MRI, well, nothing's happening. It's like, well, I'm not really hurting that much. So are you really exposing the tissues that are painful? Well, with the Msk ultrasound, I can have, the patient move their shoulder and you can see what happens, right? So we're talking about maybe an impingement of the shoulder. You can actually put that in play. You can have the patient move their arm and you can look and see what happens to the tendon, going under the acromion. So I think that's a huge advantage.
Yeah.
MRIs are static. There's nothing happening, and with the Msk ultrasound, you can have somebody move and see what happens.
Yeah, I'm glad you brought that up because exactly. I mean, you're in a tube. You can't really move your extremities, and a lot of the times the pain that we have is with movement, not with resting. You reach into a cabinet, oh, my shoulder hurts, or you take a hard step, oh, my knee hurts. So we can move the joints around. That's what we do as humans. We're moving. We're creatures of movement. So what better way to scan the joint in motion versus scanning the joint static, not moving? Muscles pull on bone. That's how muscles move the joint. That's how we move. So let's see how the tendon and muscles are functioning while they're in motion. That's one of the big advantages of this MSK is its dynamic component to it.
Yeah, and I think one of the things that really is so helpful for us as physical therapists, that we can identify the structure that's really involved, right? A lot of times we get in, say we're looking at somebody with lateral hip pain. So, we're like, well, it could be IT band problems. It could be a bursa problem. It could be a tendon problem. And most of the time, it's really hard to figure that out with some of the regular testing that we're doing. But once you put the ultrasound on it, you can clearly come to the conclusion it's this or it's this or it's this. And therefore, a treatment, I think, is really a lot more focused than without doing the ultrasound. Would you agree on that?
Oh, yeah. Yeah, definitely. I mean, we're giving movement experts here the ability to see exactly what's inside the joint and what's going on with the joint. I mean, how cool is that? You got a bunch of physical therapists who have been trained in movement of the body, who are experts in movement. Now we have the ability to look in the joint itself. You combine that with some of our special testing that you touched on. Yeah, I mean, we can pretty much be as accurate as we can be with this type of tech in conjunction with the special testing that we do. How amazing is that? I mean, it's more information for the PT, better prognosis in the end, because we know exactly what we're dealing with, and better for the patient ultimately.
Yeah, and I think you're touching on something that's kind of unique again. Comparing it to MRI. If you look at when you have an MRI, it's like, if it's an orthopedic surgeon that orders it because of your shoulder problems, I'm sure he'll do a little bit of testing to figure out what's going on. Then you go off, do this test. The person actually reading the MRI is the radiologist who never sees the patient, and then the results go back to the doctor. So there's really not a lot of confirming it. Well, you can confirm it in the clinic, right? So you're combining your special test that you do to look and see what the problem is, and then you're combining it with the ultrasound to confirm that or deny it, depending on the situation, that we're right. So I really think it increases our knowledge about what's going on with the patient, tremendously.
Yeah, it should be, and I can see this coming in the future, physical therapist's forefront tool of use. It's like PTs should be using this type of technology that, I mean, it's only going to help us. It's only going to help us, and it's only going to help confirm our special testing or not.
Yeah. I can see a really good use of that. So we're the physical therapists for UTEP athletics, and so we're typically on the sidelines for the football field. Just imagine if you get a knee injury, you think it's maybe MCL or LCL. Is it a strain or is it a tear? We can have that on the sideline, and we can look at it right then and there. I don't see an MRI on the sideline anytime soon. So
no, exactly. I mean, what better way to let a football player know that, oh, your knee's okay, or hey, we should set you out. I mean, having immediate results for the player at that time, I'm sure they would love that.
Yeah, if it's a simple sprain, bite
back
through
out
it
there
and play.
Yeah,
if something's torn or fractured, well, maybe not.
Maybe you should sit on the sideline for this one.
Yeah, exactly. So there's a ton of uses for that. So you've been doing these tests now for about a year or so. Can you give us some examples of stuff that you found while doing these tests?
Okay, yeah, sure. So just recently, I was scanning a knee, and the patient was complaining about anterior knee pain. And so I started looking at the knee, and I'm looking at the ligaments, LCL, MCL. Okay, everything looks fine. I go into the quad, and I see this, on the machine, you'll see like a black kind of, shaded area, and it can be of various sizes, of course. Well, if you're looking at the knee the knee looked normal to me. It was like a normal looking knee. But when he looked at the ultrasound scan, this patient had swelling deep to the quad tendon, deep to the quadricep muscle that you would have never known it was there, just by looking at the knee. There was no observable swelling, that you can tell even if you measured the circumference of the knee. So that was eye-opening. This patient complained that it hurt when they squat or hurt when they stood up from the chair, like the process of standing up, going up and down a step or a staircase. So what we found was there was a tremendous amount of fluid underneath the quad muscle that would have been missed otherwise. So we can treat that differently. Another one I saw was this patient was just recently off of a labral surgery, and they fell pretty hard.
This was a shoulder?
A shoulder injury, and they fell pretty hard. Well, the labrum was fixed, but the patient complained about like this residual popping and clicking when they would raise their arm. So they had a labrum injury. Let me take a look. Upon scanning, I figured out and saw that the clavicle, the AC joint, was subluxing. It was popping and moving, and I'd had this patient move his arm up and down, just like I had my patient with the quad with the knee injury. I had them extend their knee and flex their knee. Same thing with this guy with the shoulder, flex the shoulder, extend the shoulder, move the shoulder around. And yeah, you can definitely see that the AC joint was popping up and down, subluxing. So we figured, hey, he probably needs some more stability training. So that's, the course that we would talk about with the patient and the treating therapist, that, hey, these are the new steps that we can take. The MSK ultrasound is helping us guide the next step in rehab for these patients,
Yeah, and I can see that where, first of all, they're going to miss it with the MRI because the patient's laying still.
Yeah, you would have never seen it.
That AC joint is perfectly in place probably when they're laying on their back, not doing anything. And the doctor will, the MRI probably showed the labral tear. So, hey, there's labral tears, let's fix them, which is good, probably was necessary.
Yeah.
But then this part was missed, and that definitely is going to change just how we rehab the patient just a little bit, right? They still need rehab. We still need to work on it. But now you can kind of switch your emphasis. Instead of only labral tear, surgery rehab, you're now adding some AC stability, rehab. So that's just awesome. That's awesome. Any other examples that you have?
There were some, pretty interesting ones when I was scanning some hips, the greater trochanter, the big bones on the side of your hips that you can palpate pretty easily. It's pretty amazing, some of the images that I obtained in people who have a lot of arthritis and are a little bit older, the older population, and how, degenerative the greater trochanter was, and these people are complaining about lateral hip pain. It can be confused with like a bursitis or something, but when really we need to really strengthen and work on the muscles because, there's a lot of arthritic changes going on in there, not really so much of a bursal problem, So yeah, you can see changes in the cortical bone, which is some of the things that I also see if I'm scanning the shoulder. And there's a lot of research that shows that, seeing different changes in the bone will affect the integrity of the tendinous junction with the bone, So, there's a lot of pretty neat, and I don't like to say the word neat because, these are real patients with real problems, but neat in sort of a way that the patient will experience a new type of method that they can be helped by. How bad is it? And I'm sure a lot of us have been there where we want to know what's going on with our shoulder, or whatever's hurting us. We want to know right then and there what the problem is. We can be pretty impatient sometimes. Like, I want the results of my MRI or I want the results of my X-ray now, and I want them immediately because we want to know. So, that's the beauty of, having this is I can say, hey, look, there's this problem. And, it's pretty easy to describe what I'm seeing on the ultrasound machine to the patient as well. So patients, for the most part, can pick it up pretty easily when I describe, hey, this is the bone here, this is the muscle, this is the tendon here are the ligaments, and this is what I'm seeing. And the patients themselves are in awe, for the most part, that they can see what's causing them the grief. So, pretty cool stuff.
Yeah, I think it's reassuring for a patient that, okay, so we know what's going on, we can treat this, know what you're working on. I think it really increases even the patient's confidence in us that we even, I think we're already pretty smart anyway, but I think with this, it's like, it's even looks, hey, you even know better what you can do, and therefore, can really get the treatment right. I know I pulled a little bit of privilege a couple of weeks ago because my shoulder's been hurting. I have a chronic shoulder problem. I used to dislocate it playing basketball in my younger days, and so lately I've been hurting a little bit more. So I asked Anthony actually to take a look at it, and lo and behold, we're seeing some tears in different rotator cuff muscles. Not that I wanted to hear that, but definitely tells me, well, I guess I better really start working on that a little bit more and make those muscles stronger, so the pain will go away, and I'm better off. So, what would you say is the most unusual thing you've seen so far?
Most unusual scene, I would have to go probably to, the example I mentioned a little earlier, but it was on another patient that was, I don't know, way worse than the patient I just scanned. I mean, this guy's swelling went all the way. It was deep to the quad as well, but it went all the way up past the mid portion of the quadricep muscle, whereas the one I was just talking about was kind of more at the distal end of the quad. Mm-hmm. This one was extensive. I had never seen anything like this. And even in my schooling as a PT, and as a PT student, we don't really talk about some of the things that, for example, swelling deep to the quad muscle. What is that? And upon looking at the person itself, they look like a normal person, but underneath, there was a lot of fluid that was affecting the way the muscles work. And it was a guy who was coming off of a semi truck, and he slipped off the steps, and he landed with his knee straight onto the floor from a high truck, and just completely set off this chain reaction of an inflammatory response that affected his whole quad muscle. And I was looking at him. They had of course an antalgic walk, an antalgic gait. He could barely extend and flex his knee, but when I was looking at his knee, it looked normal. And that's what was interesting the most, is there was no observable swelling on this guy at all either. But when I scanned it, it was the most swelling I had ever seen. And it goes to show, how traumatic some of the internal structures, how damaged they could be, compared to an observable, from the outside. Looking from the outside in, it's a completely different story. So I've seen that, and at the time I didn't know what I was looking at. I was pretty new at the time, and getting my first scans going, and I had to check with our mentors from New York and say, hey, I need help here. What am I looking at? And they were really great at, this is what the problem is, this and that. Oh, okay. So then that whole process of me getting the information from the guys from New York was in a matter of, I don't know, minutes. I sent them a quick email, hey, I need some help with this case, and they responded that day. I probably exaggerated a couple minutes, maybe about 15, 20 minutes, and they were already responding back to me, hey, oh, this is what this is. Okay, well, interesting. So yeah, as far as unusual, that's been probably the one I would pick out the most, because again, normal looking knee, but severe swelling deep to the tendon, to the quad muscle. Nothing I would ever thought of that would occur in someone's body. Yeah. So
because we look a lot of times at the joints, and if a knee is swollen, it's probably something in the joints, and we can figure out what it is in the joint, but this is probably something that nobody would have even picked up.
Yeah, and then when I would have him extend and flex, his knee, it would get bigger and smaller and bigger. And it's like, what in the world is my? So yeah, so big learning curve there, but we learned it, and that's how we go forward.
Well, and that's why it's so good that we have these experts really backing us up, that we can
exactly
we can talk to, and they verify our work. So I think that's really comforting to know, because it is such a big step above what we're used to as a physical therapist, right? I mean, you didn't get this in PT school.
No, and there's no way I would have been able to affect this patient, because I would be treating I would have done all my special testing and not know that he had severe swelling. I would have not known where to go. I would have been doing, treating as like a regular standard knee pain patient, when in fact it wasn't,
Yeah. So now, if there's patients out there that think that they may, benefit from this, talk a little bit about, what a patient would look at, what kind of conditions or what kind of pains are they having that would be appropriate to come see you?
Well, I mean, anything in the extremities, like for example, I always go back to the shoulder because how many of us out there have shoulder pain? So yeah, it's like your everyday, discomforts. Like you picked up your backpack or something, you noticed you had some type of bicep pain or a shoulder pain or something. Yeah, those are the ones that we strive to get in the most. We have a lot of us. How many of us out there like to go for jogs or runs, or we're pretty fit and have an active lifestyle, or not even that. Maybe you work in an office and you've noticed that you're having a lot of pain reaching for the phone or keyboard or something. Maybe we're having a lot of numbness and tingling in our hands. If you work in an office and you've noticed that you're tingling a lot in your fingers, we can scan the wrists, for example. How many of us play baseball out there or throw a football or, or out there playing sports, and we notice that every time I throw the baseball, like my elbow hurts, like in the middle aspect, those are things that, it's all fair game. It's all of, that all has the ability to be scanned, know?
Well, and that kind of brings us to, it's not only muscles and tendons and ligaments, but we can look at the nerves as well, right? So
yeah, we can look at nerves. We can measure how thick a nerve is. If someone's having, carpal tunnel pain, that nerve will probably be inflamed, and we can measure it, take a diameter of it. We can compare it to studies and say, hey, look, we compare it to the other side and say, hey, look, one nerve is this big, the other nerve is this big. There's an issue here. So we can track nerves and follow the nerves, course of the nerves. And it only helps us with our MSK evaluations.
Yeah. And I think, again, a big benefit is, most of the time you're going to look at both sides and compare them.
Both sides compare. Something looks strange on one side. Okay, well, good thing is you have another limb that's the same. So let me look at it. And then we compare the structures and, see what we got. So, yeah, anything from the hips below, hips, knees, ankles, toes, all the tiny bones in the hands and the feet, those are all fair game too.
So pretty much if somebody thinks that, wow, I'm having some of these issues, I definitely want to have taken a look at it and then see what we can do about it. Can they just, call us and
give us a call, let us know, hey, I'm having this problem. I would like to speak to a therapist, and we can gladly set you up with a free consultation or an evaluation. You can come in even without a doctor's referral. It's under the direct access law that we have in Texas, but you can come in and speak to us directly, without any hesitation, or there's not really a barrier that will prevent you from coming to us to let us know that you're having a problem. There's no barriers other than you just picking up the phone and calling.
Yeah. And I guess one thing, we cannot do this via telehealth, can we?
No,
we haven't gotten that far yet. So
that'd be awesome.
Again, kind of looking at the payment aspect, most insurances do pay for it. And anybody that's, that wants to come in, we always check, insurance benefits anyway, but majority of insurances, pay for it. And if, so that shouldn't be a hindrance. And again, if somebody, because we see a lot of these large deductibles and everything of $5,000, $7,000, $9,000 or so. And again, if you have to pay out of pocket anyway, would you rather pay the $1,500 for the MRI or $200 or so for the Msk Ultrasound?
Let me think about that.
Yeah, just, that's an easy one. So, and do we need a doctor's prescription? No, but you're definitely welcome to check with your doctor, and and we'll gladly talk to your doctor as well, because some of the doctors aren't even that familiar with this technology either, so they may not know that it's available. So if you go to your doctor and he kind of looks at you like, what are you talking about? Let us know, because we'll gladly talk to doctors and let them know on that. So
yeah, this is not a go behind the doctor's back kind of thing at all. No. This is like, I've had patients and we've worked with doctors, and doctors want the results, so we can communicate the results back and forth that, hey, I found this, and send them and forward them the results of your MSK ultrasound, and we go back and forth. That's what it's all about.
Yeah. So this is also for some of the doctors that are out there, if you're listening to this. If you have patients with these kind of issues, refer them to us. Again, you're saving your patient money, and you're getting, a test that's going to show it. And again, we can make it a dynamic test that may even show more information. So awesome. Well, Anthony, thanks for being here with me today. Any parting words on this?
Well, I would like to say, since we started on this journey with the MSK ultrasound, it's only reinforced the way we practice here. I've been getting tons of scans in. I've been getting tons of patients referred, by other therapists to help them, look and see what's going on exactly. So, I would say this is probably the forefront and cutting edge tech that physical therapists have always wanted. There's always been special tests. There's always been goniometry. There's always been research studies out there to help guide what we think is going on. But this, to me, is almost a game changer, or it is a game changer as far as the future of physical therapy practice. I mean, again, we're arming physical therapists with now the ability to see the muscle work at what it's supposed to do. Now we can actually see it rather than just do a special test and then, okay, based on this study and based on this study, we can come up with a probability that this is probably what's going on. That's the status quo of things. So not anymore, not anymore. So we're really excited about the future, here at Spine and Rehab about, what MSK is going to bring for us and for, most importantly, for the patients, because, I've been a patient before and I want to be informed, so how cool is it that now I can inform a patient exactly, hey, this is the issue here. So yeah, forefront, cutting edge stuff, the new tech that we're bringing in, it's just exciting for the future, for sure.
And I really think it makes, spine and rehab specialists the leader in physical therapy, definitely in the El Paso area. So, Anthony, thank you very much for, spending some time with me. So this is the end of our, second episode of the Spine and Rehab Specialist podcast. Stay tuned for our next upcoming episode. It will come out in a couple of weeks, and we'll see you then.